Hi, I'm Dr. Keith Ryan. I wanted to talk to you about sacroiliac type of problems. Sacroiliac problems can be one of the most common type of thing you can occur when you're having low back pain. Now, if you look at the spine here, you'll see, you have your spine. I mean, normally you're looking at it with skin, but this is what it looks like in the bone. So this is really what I'm working at. So the part that we're getting on is the neck up here, the upper back, the low back, the sacrum, your hip bones across over here, and your iliac crests over here. But the sacroiliac joint is the joint that comes here between your sacrum and your iliac across there. And that joint can get out of place from all kinds of things, from lifting wrong, from overhead to being twisted. You can get it out of place from sleeping. It can be one of the more painful type of injuries you can have. It can cause symptoms of from really bad pain to just kind of uncomfortable. It can cause pain in the hip. It can cause pain down the leg. But it's one of the more easy things to fix that we do. See it all the time. Lots of people get it. And we can adjust those joints and get them moving right. Sometimes you're just adjusting that joint. Sometimes you're adjusting the lumbar. Sometimes you're adjusting the femur head. But we can get those moving right. So we'll physically adjust those joints. I'll use ice to bring down swelling if it's there. We'll use some physical therapy to bring down swelling, inflammation, because it can cause, when it goes out, a lot of swelling, a lot of inflammation. That's the part that really hurts. And it makes those joints so they don't work right. So that when you're doing things, you're trying to walk and move, lift your legs, turn and twist, and that joint's not moving. So your muscles are pulling on that joint, trying to get it to go, and it's not. It causes a bunch of inflammation. So we'll use some therapy, some ice, that sort of thing to get the swelling down while we're getting the joint moving right. Then we'll teach you some exercises to do that'll help it from coming back again and again and again afterwards, because you did it, so something happened to have it come on. So you want that to be functionally working, and then you want to develop the kind of exercises to keep it coming back. Because if you've got one of those sacroiliac joints that hurts a lot, let me tell you, you don't want that business coming back again, because it's really disruptive to your life. So, if you have this sort of thing, this is something we can work with and probably get you down the road pretty quick. Thanks a lot for listening.